Hey guys, Dr. Kentaro Ku, Clinic Director at True Lifestyle Wellness. Today we're going to talk about the thyroid. We're going to dig deep into this condition called hypothyroidism, which is poorly managed within the medical community. Current research is showing about 90% of thyroid challenges is a condition called Hashimoto's, which is the autoimmune version of it. Now, you go to a medical doctor, they're gonna, look at your TSH, T3, T4 levels, but are they gonna look at your thyroid antibodies? Probably not, because it's not gonna really change their treatment protocol. What's their treatment? Typically, it's Synthroid or levothyroxine. It's a synthetic thyroid that's gonna shut down your thyroid, and so you're gonna be on this medication forever. You're on this medication probably for the rest of your life, which is, it's a big payday for the pharmaceutical companies, right? So it's a really big mess. So you have to support the immune system. What you need to do is to determine, do I have the Hashimoto's version of it or do I not? So that's really step number one, is you need a test called TPO, or it's called thyroid peroxidase antibody test. The presence of TPO antibodies in your blood suggests that the cause of thyroid disease is an autoimmune disorder such as Hashimoto's disease or Graves' disease. In autoimmune disorders, your immune system makes antibodies that mistakenly attack normal tissue. But then your treatment protocol is not, synthetic thyroid. It's, hey, let's boost up the immune system. Let's fix it, support it, pull out the culprits that are messing up your immune system. Does that make sense? So we start with the food test. That's step number one. We'll pull out the foods that your immune system doesn't like, give your immune system a break from all this trauma. And I think this is why we have 50 million Americans with an autoimmune condition, and there's also 140 varieties of it as well. So Hashimoto's is one, but then we also have lupus, MS, rheumatoid arthritis, celiac disease, Crohn's disease. There's a whole slew of autoimmune conditions. So my step number one is always, let's adjust the diet. Let's fix the gut. Why? Most of your immune system is in the gut. So if you have leaky gut, tight junctions are open, we got to tighten them back up, right? We got to restore them. We got to clean out all the parasites and bacteria that are flourishing in the gut. Just the nasty critters. Just to, clean out the bugs, restore the gut, fix your leaky gut, tighten up those tight junctions with specific, protocols. Does that make sense? So that's, autoimmune. They're gonna come in a box full of supplements because, they were labeled with an autoimmune condition, and now they're on all this cortisone and all this medication that suppresses their immune system, and now you have all these side effects. That's what's typical. They're like, I weigh 30 pounds heavy because I'm on all this cortisone, prednisone, whatever, all this medication, and I feel really toxic. I mean, it's a really bad cycle to get on, and I think we can do better. But it starts with finding and fixing, right? So finding the root cause, for starters, let's fix it. Why is it there? What can we do to fix the underlying root cause? And it takes, a functional medicine doctor to dig, right? So not just spend 5 minutes with you, do a test and say, hey, you have an autoimmune condition. Now you're a label. Here's your medication. See you next time. Adios. And then, they're off to the next patient. You need somebody who's going to spend time with you, ask you questions, who's going to dig, who's going to do the right tests. The TPO, the thyroid peroxidase antibody test, the optimal range is less than 2 IUs per milliliter. That's the functional range. The standard range is less than 35 IUs per milliliter. Actually looking at your immune system markers to see if that's the type of thyroid condition that you have is going to be important. Guys, there's so many people that are on these medications, they're still walking around with these thyroid symptoms, right? So, they're walking around with weight loss resistance, constipation, brittle nails, their hair's falling out, they're cold all the time. I mean, those are the main symptoms, thyroid symptoms that people have or still have. Just because you're on medication doesn't mean the symptoms are going to go away. Again, it's very poorly managed condition. A lot of it starts in your gut, and doing the right tests to determine the sensitivities, deficiencies, and toxicities is step number one. Then what we need to do is we need to fill in those gaps and clean out other things. Now, it's common to get personal requests asking us to comment on their personal thyroid labs. However, I can't provide medical advice through the internet without doing a personalized, comprehensive case review. This is for your own safety, obviously, as well as complying with, liability laws or professional liability laws. If your doctor is ordering these labs for you, be sure to request a copy for yourself to ensure that they're going to be looked at and interpreted correctly. Also note that your information is based on optimal functional medicine ranges. It may not be recognized by other doctors who are not familiar with functional medicine. Right, guys, have a great day. If you have any questions, again, throw them in the comment section below. If you're watching this on Facebook, if you're watching this on YouTube, please subscribe. If you have any questions on YouTube, just throw it, in the comment section below. Guys, have a great day, and